everyone, I am Emily. I'm one of the chiropractic assistants here at Innate Life, and I am also a birth doula. So welcome on, people. If some of you don't know what a birth doula is, I am a trained professional and I support birthing people before, while they're pregnant, during pregnancy, while they're giving birth, and some postpartum. So hey, Michelle. I'm excited for everyone to be joining me. We will wait a minute or so, we'll let some people get on, and then we will get started. I am going to be going over, I have a series of questions I've been receiving from a lot of birthing people about what is going on right now. What are their options? What does COVID-19 mean for them for giving birth in the next few weeks, in the next month, and after? So before... Hey, Brooke, before we get started, thanks, Michelle. We are going to get started. Here we go. So one of the questions are, pregnant people, are you at more risk for getting COVID-19 versus the general public? And the answer is no. So anyone that is pregnant, you are not more at risk unless you have any underlying health conditions. And that goes in hand with staying healthy, keeping your immune system strong, and doing the whole social distancing, doing your thing. Right now, the best thing to do, follow your safety precautions, but also make sure you're getting enough exercise, which is great for pregnancy and labor, as well as boosting your immune system. Another thing, make sure you're getting adjusted, making sure you're getting enough nutrition, enough adequate, that sustainable energy that you're going to need during your pregnancy and also for birth. So what happens if you have tested positive for COVID-19? What does that mean for you and your baby? Right now, it does not appear that it can be transferred to the fetus. There's limited amount of research, as this is all new and there's no evidence on it yet. But the handful of positive cases from COVID-19 after birth, sorry guys, this was cutting out there. The handful of positive cases in newborns of COVID-19 has happened after birth through being around the virus. So it cannot be transferred in uterine right now. There's no evidence based off of that. So if you are pregnant and you're tested positive with COVID-19, will you be separated from your baby? Will you be quarantined in the hospital? What is the hospital visit going to be like for you? And so we'll go back in February. The CDC made a statement, and what they said, in quote, is to reduce the risk of transmission of the virus from the mother to the newborn, facilities should consider temporarily separating the mother who has confirmed COVID-19. So what that means, birthing parents were being separated from their babies, even though that this was only a recommendation. This was not a mandate. This was only a recommendation. But now they have made a revision in their statement, and to quote, the many benefits of mother-infant skin bonding and contact are understood. So they are recognizing the benefits of skin-to-skin after birth. It increases the likelihood of breastfeeding, stabilization of glucose levels, maintaining infant body temperature, and even though the transmission of SARS-CoV-2 after birth via contact with infectious respiratory secretions is a concern, the risk of transmitting the virus in infants is not clear. So what they're saying, that they are recognizing the benefits of it, that the skin-to-skin contact after birth, there's so many benefits in that, with breastfeeding, with regulating the baby's body temperature, glucose levels. So these are all recommendations by the CDC saying that it's kind of up to the mom, and that there should be a conversation between the care provider and the mother before this decision is made if the mother has COVID-19. So the benefits right now outweigh the risk if you have COVID-19, if you are positive with COVID-19. So if you are positive and you give birth, that you should practice extreme hygiene. Make sure you're following cleanliness, making sure you're washing your hands, using a face mask if you decide to breastfeed. and just positive, extreme hygiene. So right now, I know there's a lot of worry if you are giving birth in a hospital. So what are your options? A lot of people are trying to explore other options without not having to go into a hospital setting to worry about possibly being around the virus right now. So hospitals, they're taking a lot of extra steps, extra precautions for birthing people and newborns. So some other great options if you don't want to give birth in a hospital are birth centers and home births. These are two awesome, safe options, especially if you are at low risk. There's so many different benefits to having home births and also to being in a birth center. If you're in a birth center, you have the freedom to eat and drink how you want. You have more control. It is a more comfortable setting, and in birth centers, you're not going to feel like you're being pushed for any type of intervention, for any type of other medication that might not be as necessary. There is definitely a reduced price. So the price of being in a hospital drastically changes if you decide to have a home birth or if you decide to go to a birth center. One of the best birth centers in the nation is the Pittsburgh Birth Center, and they are being extremely accommodating to birthing people wanting to change their setting. So shout out to the Pittsburgh Birth Center. They are doing awesome, and I've heard so many great things recently about them. Even though there's a lot of changes going on, they are doing the best that they can to keep everyone safe and healthy. Now, with home births, this is another great option. I became a doula because I watched my own mom have home births. So home births are a great, safe option. You are in your own setting, you're in your own environment, which is so beneficial during labor, during birth. You're familiar with it. You can move around freely as you want. You can eat and drink as you want. You can have anyone there with you. You're not limited to visitors being with you. So after this is all said and done, I'm going to provide some resources of the local home birth midwives and also, hey Maggie, some of the home birth midwives and also the birth center. So you're going to have some options if you are interested in exploring those. Now, if you are giving birth in a hospital, what are some policy changes? What is going on right now? So you want to talk to your provider because every place is different. But currently right now, hospitals are only permitting one support person. So that means you can pick one person to come with you to the hospital. That can be your partner. That could be your doula. That could be a sister, a friend. That person has to be 18 years or older and not been in contact with COVID-19 or have any symptoms. That person has to be there for labor and delivery as well as postpartum. So it doesn't mean like I can't be in the lobby waiting to go in and tag team give the partner some time to rest, even though that would be ideal, that would be awesome. That is not able to happen. So you can pick one person, they have to continuously be with you. Now, even as those policies are in state right now, the American College of Obstetricians and Gynecology, they're encouraging hospitals to consider the well-being of the laboring person because they know the benefits of having emotional support, the benefits of having physical support constantly for that laboring person. So they are trying to encourage hospitals to change this policy. So right now, what you can do if you have a doula or if you have someone that has been with you throughout this pregnancy for support and they're not going to be able to be with you, talk to them about virtual support. This is still a really, really valid type of support and can be really beneficial to you and your partner during birth and labor while you're in the hospital. Even though they can't be with you, they can be with you over phone, and we're here for you. We're cheering for you guys. Now, when you get to the hospital, some other things, visitors and patients, you might be screened for COVID-19. So what that means is there could be a series of questions you might be asked. You might have to do check your temperature, and you also might have to wear a mask as there are some new mandates that came out recently in Pennsylvania. You might have to wear a mask if you're a visitor and if you are the birthing person. Wearing a mask is recommended for the birthing person, but it is not ideal during the pushing stage. As most of you can guess, pushing and all that strenuous breathing it's not going to be effective if you're wearing that mask. And also, hey guys, it's just not ideal. You're not going to get the amount of oxygen you need, and the birthing person, it's not going to work. So they are letting the birthing person go without a mask during the pushing stage. So those are some things you might want to talk with your provider about beforehand, before you go to the hospital, before you're in labor, so you're not hit with a surprise, because the littlest changes can kind of throw off your game plan and your mindset. So after birth, if you decide to breastfeed, right now, if you're positive with COVID-19, there have been no evidence that the virus that causes COVID-19 is present in breast milk. The AAP, the American Academy of Pediatrics, they affirm that there are known benefits of breastfeeding, so that the mother's milk may provide infant protective factors after maternal COVID-19. So what that means is that there's no evidence that COVID-19 can be transferred through breast milk, but we do know the evidence that shows the antibodies that the body can create for the birthing person, for the baby while they're breastfeeding. So breast milk is amazing. There's no known evidence yet about COVID-19 because it is so new, but we know the power that the body has, and the power that it's able to do. So if you are an infected mother and you want to breastfeed, infected mothers may express milk with careful hygiene, and designated caregivers may feed the milk to the infant. Or if the mother also requests skin-to-skin contact with her infant, which again is so powerful in the beginning stages for bonding, for breast milk to even come in, that she should comply with strict preventative precautions, including using you want to be able to use a mask, make sure you're cleaning your breast, your chest area, and just having good hygiene while you're handling your baby. Obviously, you're going to have great hygiene because it's a new baby. No one wants to have germs all over their baby, but you're going to be extra careful right now during a pandemic because it's a little scary. So what that means is breast is still best after birth, even if you were tested positive for COVID-19. Now, I have had a few questions with COVID-19 that providers are offering the option to schedule your birth. So scheduling your birth, this means that you can decide when you want to have your baby. It is an elective induction, and it is a medical process to medically start the process of labor in the body. And there's so many different ways that this can happen. This might sound exciting for some people that you're able to schedule your birth. You're so excited to meet your baby. But if you want to have a natural birth, this is not something that's going to be ideal for you. There are a lot of other medical interventions that are associated with having an induction. This could mean having hooked up to an IV. This could mean other medications. This could mean other induction methods, not only one method, but more than one. And this also could be fetal monitoring, that you are hooked up, the baby's being monitored constantly. And if those things are going on, you can be restricted to movement, and movement is so important during labor and birth. So you could be confined to your bed possibly and not being able to move freely as you'd like. And also you might not be able to eat and drink during labor. So those are really some things you want to talk to your care provider about. And if you decide to have an elective induction, you want to look at that care provider's statistic. If high cesarean rate is associated with, hey Emma, if a high cesarean rate is associated with that care provider's induction rate as well. So those are conversations that you should bring up ahead of time, see what their methods are, if that is something that's going to be offered down the road to you. With all these changes going on, you definitely want to plan ahead. It's hard to plan ahead as things are going day by day, but you want to have these conversations now And do your research now so you are prepared and you are confident in making those decisions. Now, what can you do to lower your anxiety, lower your stress levels? Right now, all of our stress levels are up. COVID-19 and all the changes, all these policy changes that are going on, it's stressful enough, but being pregnant on top of that adds another level of fear, another level of anxiety. So some things you can do you want to be able to recognize what labor is, what does labor mean, and how do you know it's coming? How do you know it's actually happening? You want to be confident when it happens, that you're not going to be worried, that you know that your body is going to be able to do what it's able to do, and you're going to be able to handle labor the way that your body knows how to. So what you can do, there's a few things. You can take a virtual childbirth class. Right now, there's telehealth communication, telehealth visits going on with care providers, with all types of childbirth classes, virtual doulas, virtual lactation support. So there are outlets for you to get resources from. And when this is done, I will attach a link and I will have some resources for you. Some of those are free. There's so much available online. Take advantage of it and educate yourself. So laboring signs are different for everyone. So some people have their water breaking, some people feel crampy, some people have contractions. Everything's different, but some of the main and most common signs of labor, first is when your stomach begins to drop, is when you have your belly's lower, you can feel more pressure in your pelvic area. That is great. The baby is beginning to make its way down and down into the birth canal. Any changes in bodily function. So you want to be more aware of your body, of any type of bowel movements. If you start to get nauseous, if you're going to throw up, your body is preparing for birth. So it is expelling everything else that it does not need and preparing to make room for the baby to make its way down and out. Some other things are nesting. This means sudden bursts of energy. If you feel like cleaning the whole house, baking a bunch of cookies, making sure you have everything ready, you have all this energy, this is another sign of labor. Also, if you feel extra fatigued, if you're extra tired, this can be a sign of labor. And that doesn't mean like you're just tired. It means out of your normal. What is not your current normal situation? And if you're tired, rest. You're going to need this energy during labor, during birth. So if you feel tired, rest. You're going to need it. So some other things, if you lose your mucus plug. So your mucus plug is a thick, just what it is. It's mucus. It's a thick membrane in your cervix. And when it is time to give birth, your body is going to expel it. And it can be expelled in a big glob, or it can come out in bits and pieces. And sometimes it can be tinged with blood. It can be a little pink. It could be a little red. And you're not always going to see it. Sometimes it will come out while you go to the bathroom and you won't even notice it. Or you might see it in your underwear throughout the day. So be more aware of any type of bodily discharge, any type of bodily fluids, because these are changing in pregnancy, and you want to be more aware of what's happening to your body. So another thing that I hear a lot is, I feel like my baby is going to fall out of me. Some birthing people have said that, and that is your body's hormone called relaxin. Relaxin is a hormone that relaxes and loosens your joints and ligaments to prepare to give birth. Your pelvis has different pliable areas, and it's going to need to move. So the relaxin, that hormone, is getting your body, getting your pelvis ready for the baby to make its way down the birth canal. So if you feel like you are really loose, if you have loose joints, that is a good thing. Your baby won't fall out of you, but it is coming and it's getting ready. So also, if you start to get contractions, contractions can be a little bit different for everyone, and they can come on differently. You can feel crampy in your abdomen. You can feel they're like almost like period cramps. You can feel that in your pelvic area, in your thighs, in your lower back. And if you start to feel these contractions, what you should do is take a large drink of water and lie down or change positions. If you're sleeping, roll over, do something different. If these contractions don't go away, most likely this is the real deal. Congratulations, labor is starting. But if they go away, these were Braxton Hicks. And those are still really great because it's preparing your body, it's preparing your uterus for the real deal. So if you start to get contractions and they don't go away and they are the real deal, there's something called the 5-1-1 rule. And even as a doula, I always get this mixed up. The 5-1-1 rule is if you have contractions and they are 5 minutes apart, they last for 1 minute long, and they have been that pattern for 1 hour. So if you're having a contraction every 5 minutes, they're lasting 1 minute long as you're having them, and they have been like that for a whole hour, that is when you should probably call your care provider and let them know the consistency, the frequency of these contractions, and that might be the time to go to the hospital. Right now in the UK, they are actually recommending women to stay home as long as they possibly can to avoid going to the hospital too early. There is no need to go to the hospital too early. It might be unnecessary. And sometimes if you go to the hospital too early, that can put a halt in your labor. That can change things. So your contractions can stop. If they're not as frequent, that can put a halt in it. And when labor starts, you are excited, you're ready to meet the baby, and you don't want it to stop. Another thing that happens is your water breaking, and a lot of people think that your water breaking is like the telltale sign, like that is it, the baby's coming. But actually it's less than 15% of births is the sign. Water breaking happens in less than 15% of births as the sign of labor is coming. But when your water does break, it can be a large gush of water, or it can just be a small trickle over a few days. That can happen. So again, what's going on here? If you are in labor and those contractions are not stopping, and this is the real deal, there are some ways for you to cope with at home, some reasons or some things that you can do to avoid going to the hospital too early. So if you are having those contractions, continue on with your day. You want to continue doing everything that you normally do, whether it's doing the dishes, go for a walk. Gravity is your friend and exercise is your friend. Movement is your friend right now while you are in labor. So go for a walk. Do what you can do exercise-wise. If you like to do yoga, do some yoga. Eat and drink. You want to make sure you stay hydrated. This is so important. Your body is going to be basically running a marathon on the inside, getting the baby out, working extra hard. So you want to make sure you have enough nutrition that is sustainable. So you want to have sustainable energy. Make sure you're eating and drinking enough to sustain you to give birth and have a baby. Some other things you can do is just to relax. Take a shower, take a nice bath, relax yourself, relax those muscles. An ice pack or heating packs, if you are having any type of discomfort, back pain, ice packs and heating packs can be your best friend right now. Make sure when you're at home and you're laboring and trying to deal with these contractions, that you are in a peaceful environment, that you're not stressed out. You want to make sure that it's a safe environment, that you're calm, that you're around people that you can trust, that you're able to do what you want to do, and you don't really have to worry about anyone else right now. So lower your stress levels down, whether it is dim the lights a little, put on some music. Sight and sound have such an impactful role in labor. So you want to make sure you're in a good, calm environment. Also, what you can do is take a belly pic. Take the last picture you're going to have of you being pregnant. It's such an exciting time. Take a picture of your belly. Some other things. Focus on your breathing. Try to relax. Relax your face muscles. Relax your jaw muscles. The muscles in your jaw are actually directly correlated to your pelvic muscles, your pelvic floor muscles too. So you want to make sure you have a relaxed face, a relaxed jaw. This is really important. Positive birth affirmations. So birth affirmations are one of my favorite things, and you can make birth affirmations anything you want. They can be as my body is healthy, I am ready to give birth, I am proud of myself, whatever feel-good things that you want for labor and birth, write them down, record them, play them back, read them out loud. Stand in the mirror and look at them and read them to yourself. It comes down to mindset when you're in labor and you are prepared for this and your body is made to do this. So you will be confident in giving birth and you will be ready and prepared for it. So some other things, talk with someone, distract yourself for a little bit, give someone a phone call. Kind words and a comforting voice can go a long way right now. Now, if you cannot distract yourself anymore with some of the things that I just listed, you're going to probably start getting some contractions that are going to become longer, they're going to become stronger, more intense, and they're not going to stop, so they're not going to give up. So when you cannot distract yourself anymore, you're going to become more focused on yourself, more focused on getting through each contraction. You're going to become inward. Some women go really inward, become really quiet. Some women become louder and make a rhythm of whether it's moaning or breathing. You're going to get in your own rhythm what feels good for you to deal with each contraction and go through each contraction. You're going to change. Now, breathing is really, really important during this. You don't want to hold your breath. You want to take some slow, deep breaths, or you can take some short breaths, but you don't want to hold your breath. Another thing I always tell birthing people is to take a cleansing breath. Take a deep breath, blow it out, and get through this contraction and get ready for the next one. So most of the things that you can do, you can rock back and forth, you can go back and forth on your hands and knees, you can squat, you can sit on a birth ball. Birth balls are so great, and you can find them just about any store you go to. You can find them at Target, at Walmart, there's some discount stores around, any sporting goods stores, but birth balls are really great to alleviate some pain, some discomfort, and as well, if you are sitting on a birth ball, you can move back and forth, you can rotate your hips back and forth, and that type of movement is going to open up your pelvis. So it's going to rock back and forth, and it can feel really comforting on your back, but also it's going to help the baby make its way down the birth canal and descend. So it's really important for comfort as well as helping the baby descend. Some other things you can do, like I said, you can go on your hands and knees, rocking back and forth. Hold on to your partner, holding hands. You can squat with them. Any type of positions that feel good for you, do it. You want to do things that feel good for you, and remember, gravity is your friend. So with that being said, we are going to go over some positions, some things that you can do at home during labor, and you can also do at the hospital. So I'm going to have Mackenzie come in. She is a non-pregnant person, but she is going to help me out and give you guys some visuals on what you can do. So most hospitals have birth balls. Most hospitals have something called a peanut ball, which is what I have back behind me. So we are going to go over a couple things. So we are going to show you what that is. So the birthing person is going to go on their hands and knees. And so Mackenzie's going to go on her hands and knees. I'm so thankful she's doing this for us today. So being on your hands and knees can feel really, really good for the birthing person. It will let the belly hang low, let gravity do its job there. But it's going to take pressure off the back and the pressure off the pelvis as you'd be standing up. There's going to be a lot of pressure pushing down. So with back pain, if you're having any back pain, any back labor, any pain in your pelvis, what you can do, you can take your hands and you're going to put them one on top of another, almost in a flat form, and you're going to take it. And do you mind if I touch you?
Nope, that's all right.
So you're going to find where the tailbone is, where the sacrum is, and you're going to take the palm of your hand and press into the tailbone. And you're going to put pressure there, and you're going to hold that there. You can hold it for a few seconds, for up to a minute. for as long as the birthing person likes. So what this does, you're putting pressure against it, and it's kind of like a push-pull type of movement. This can be done during contractions, or can be done not in between contractions as well. So basically you can do this whenever the birthing person likes and it feels good for them. Another thing that you can do is called a hip squeeze. So this is one of the tools and one of the things that a lot of birthing people really love, whether or not they have back pain or not. So what you're going to do as well, they're going to be on their hands and knees. They can also be, you can also hold over the top of a bed in the hospital, whatever is more comfortable for you. But what you're going to do, you're going to find the hip bones on the outside, and you're going to take the palms of your hands, and you're going to find the hip bones, and you're going to push inward. So you're going to push inward, and you're going to squeeze those together. And you can hold that for a few seconds, and release, and do it again. And you can do that continuously, or just however the birthing person likes and what they like to do. Again, this could be used at any time. This can be used not while you're in labor. If you're pregnant and that feels good to you right now, go ahead and do it. It's not going to do any harm to you. So if you are in the hospital and you have an epidural, one of the tools that I love is my peanut ball. So most hospitals will have a peanut ball. It looks like this. They do come in different sizes, but a peanut ball is usually found like in the closet of the birth room or the birth center, or just ask a provider, ask a nurse, ask someone if they have one of these, and they will grab one for you. When you have it, you do want to make sure you put a sheet over it or some type of cloth or protective covering, because while you're in labor, there's going to be a lot of bodily fluids coming out, so you want to protect this, and it'll be more comfortable for you as well. But with the peanut ball, this is great because what it does, I'm going to have Mackenzie lay down, and she is going to demonstrate kind of where this is going to be placed and how it's going to work. So it's going to be placed between the two legs and in between the knees. So it can be placed just like that in between the knees. Make sure the knees are parallel. And what this does with the peanut ball in between there, it's helping her pelvis to open up. It's creating more space. So as you create more space, the baby's going to be able to descend more. It's going to help your body dilate more. Now, whenever you do this and you use the peanut ball, you want to do 15 to 30 minutes, and you want to make sure you're doing it on each side. So if you're doing this, you want to make sure you flip over to the other side and do the other side for 15 to 30 minutes as well. This can feel really good. If you are having pain or discomfort in your hips and low back, this can feel really good. If you have an epidural, you most likely won't feel that, but this is perfect if you are confined to a bed with an epidural. This is so effective, and women love using this. So thank you, Mackenzie, for doing that. Yep. Now, if you guys have any questions, I'd love for you to drop your questions below. So before I say goodbye, I'd like to go over a few things. We all know that COVID-19 is so new and it's going to go down in history, but remember that this is your birth story. This is your time. You're not going to have another birth like this before. You might have other births, but this is yours, and you want to make this special. So reach out if you need support. If you need help, if you need support, make sure you're getting the help that you need so you feel confident in your birth, and ready for pregnancy and delivery, that you're not scared, that you don't have those worries. Get those fears out ahead of time, because they will come up in birth, and that can play a really big role in it too. This upcoming Tuesday on Innate Life, we're going to be going over stress. So we're going to have a stress talk, and it's April 21st at 1 o'clock. You want to tune in for that, because stress plays directly with pregnancy and labor as well. So stay tuned for that. That's going to be really beneficial for anyone pregnant. And also, if you have any questions, reach out to me. My Facebook is Emily Fry Doula. I am supporting people in the community right now. I've helped birthing people all over Western Pennsylvania and supported them in their birth choices. So I'd love to help you. If you have any questions, reach out to me, email me, drop some questions below. But in the event, I will also be posting a list of resources. So I have a list of resources of home birth midwives. I have the birth center. I have any virtual lactation support, virtual doulas, virtual postpartum. So there's a bunch of resources that I'm going to be able to give to you as well. So I'm so glad that everyone came on here today, and it was exciting to give you this information, and just know that even though COVID-19 is going on, you're still able to have a safe and confident and healthy birth. So, all right, guys, I will see you next time we do a video. Have a great night.